My name is Dr. Satya Sarma. I joined Access first in November of 2019, and then about a year later, I moved to the part of Access that houses the American Indian Health Plan, which is the Division of Fee-for-Service Management, or DFSM. And I stayed there for about 10 months.
So could you just tell us, for people who don't know, you mentioned Access. What does Access stand for and what is it?
So Access, AHCCCS, stands for the Arizona Healthcare Cost Containment System, and it's the name for Arizona's Medicaid agency. So Access administers Medicaid in Arizona.
And Medicaid is?
Medicaid is a government program for people who are indigent, basically, and need health care.
Okay. So in May 2023, the governor and the leader of the state Medicaid agency, Access, announced massive fraud schemes that had fleeced taxpayers out of a significant amount of money that's now estimated to be more than $2 million. When was the first time that you actually either heard about the fraud or suspected there might be fraud?
Very soon after I first got to the agency, I heard frontline staff present information to a group of Access leaders that it was around financial improprieties. When I moved to DFSM, when I moved to my new role in 2020, my team investigated and uncovered cases of patients being harmed. Sometimes that harm rose to the level of criminality.
And when you say patients being harmed, could you just elaborate on that very briefly, what that means?
Sure. So in my department, we took in complaints from providers, from Access recipients, around concerns they had about the care they were receiving from providers. Certain behavioral health providers who had complaints lodged against them ended up having findings of serious harm to those patients.
All right, good. Okay, so in just a sentence or two, could you describe whether and when and how state leaders could have actually stopped the fraud earlier and maybe prevented the level of money that was, defrauded and the level of patient harm that occurred?
Stephanie, all Access leadership had to do was listen to my team and take them seriously. Instead of taking decisive action, what I saw there was that leadership delayed, deflected, ignored us, shut us down, and intimidated us. And that calls for accountability.